John Rakoczy here with Assure Occupational Testing, and today I'm answering your top questions about drug testing for cannabis. Today, the question that we're going to tackle is what test proves impairment from cannabis? So, the quick answer to that one, we're just going to jump right into it. What test proves impairment from cannabis? Quick answer is none. No drug test in the market today will show that this person is impaired by cannabis. What it will show you is at the time of the test in the substance that was tested, that drug was present. So THC was in that person's system at the time of the test. It doesn't show impairment. So then what's the point of drug testing? We're going to get to that in a second. But to understand uh, drug testing and when it shows up in a person's system and why and for how long, we're going to look at something called the window of detection. So it depends on what you're testing for. You can test for drugs in 4 different substances. Number one that we're going to look at is hair. A drug will show up in my hair about 5 or 7 days after I ingest the drug. So I ingest THC. It takes about 5 to 7 days before it's growing out of my hair. So a hair shows me can go as far back as 90 days. About half an inch shows about 30 days of use. So if I have an inch and a half of hair, I can go back as far as 90 days to show what I've consumed. So hair is certainly not helpful in terms of looking at impairment. Blood, if I do a blood test and you test my blood for drugs, THC is going to show up in my blood within hours after I use it, but it'll be gone in a few days. So blood is a good indicator of recent use, but blood is not used in workplace situations. Blood tends to be only used by law enforcement. Oral fluid, so saliva, a mouth swab. THC is going to show up in my saliva for potentially minutes after I ingest it to potentially up to 48 hours after ingestion. THC is going to show up in a person's urine from hours after ingestion to weeks. So now let's talk about why is there the gap, hours to weeks, minutes to hours. Here's the contributing factors that come into play regarding how long it's going to stay in my system. What substance are we being tested for? Cannabis can stay as long for a few weeks. Cannabis stores in fat tissues. Other drugs are water soluble, so the body can excrete them faster. So if you're testing for marijuana, it hangs around longer. Cocaine, for example, can be out in a couple of days. Amphetamines, a couple of days. Another contributing factor is how much has a person consumed. The more you consume, the more that's built up in your fat cells, the longer it takes. How did a person consume? If you're a daily user versus a once a year user, daily user, as more it's built up, it's going to take longer to get out. How long have you used for? Have you used daily for the past 12 months? There's lots built up in your system. It's going to take longer to get out. Again, if you just use briefly, it might be out in a couple of days for THC. What was the THC concentration? Was it 3% THC? Was it 30%? The higher the concentration, the longer to get out of your system. What's a person's metabolic rate? Higher metabolism, it gets out faster. How was the substance ingested? Was it inhaled, eaten? Was it an oil or a topical cream? This comes into play when we're talking about how quickly after a person ingests it, how quickly after is it detectable on a drug test. Overall health. What's the overall health of the person? What's their diet? What's their fluid intake? Poor health, toxins are staying in longer. Better health, they're getting out quicker. Body mass. Again, THC is fat soluble, hangs around in fat cells, so it takes longer to get out. So someone with higher body mass, it's going to hang around longer. So if there's no test that proves impairment, another common question is, well, why are we drug testing? And a drug test is an important